Our mental work in Bungoma. Our chief guests, all present. Good afternoon. My name is Oscar Fata, and we celebrate the year of impact by basic rights. We concur with me that indeed 2 decades is an important milestone. Basic rights have been in Bungoma County for over 5 years, and they have been undertaking activities currently in Pleasant County. Initially, they rolled down in Lily, and currently they are in Bungoma. They have played several key roles in this county, including the formulation of the mental health policy, which was done by Basic Rights. They have also funded mental health services to the 3 sub-counties. Indeed, the trends are changing. Basic needs also, since the 5 years that they started being around, with Dennis and Eric, we acknowledge your presence and we urge you, if we can extend the mental health services to more than the 3 sub-counties. We all know that in the improving conversations on mental health, we are a bit by bit demystifying the myths and conception, and hence changing how we see mental health services. As I sit down, before I welcome my colleague to tell us more, I would wish you to be reminded that there is no health without mental health. As short as it is, thank you. I invite my colleague.
Thank you, Oscar. Thank you so much. Writing on all protocols observed, I salute you all. On behalf of the CEC, Bungoma County, I welcome you to this auspicious occasion that is very pertinent, and we are excited that we are here today. Before I proceed, I have one important person to share 1 minute with me. That's Kiblai Kam. Want to let you know what we also do in health as regards adolescents and youth, so that going forward we can partner together.
I'm riding on the already established protocols. Good afternoon. My name is Vincent Kiplai. We work with Lambisia and Oscar in the Department of Health. And I also have another colleague, you can just wait. We work in the same office. I coordinate adolescent sexual reproductive health, child health, and gender-based violence services. And I also want to take this opportunity to congratulate Basic Rights on this great occasion of celebrating their 20 years of impact. As a county, we are proud that you are working closely with us. And as a department, as I mentioned, I work with the adolescents and the youth. This is a cohort that is going through a transitional phase. And if there is a group that is hard hit with mental issues, it is adolescents and the youth. So we thank you for coming to Bungoma. And we look forward to working closely to ensure that our young people get the right services, get the right advice, the right information to make the choices. Because this is and in their lives that a small mistake can cost the entire life. And most of the mistakes come about as a result of mental issues. Our young people have what I want to say is poor emotional intelligence at this stage. So your coming to Bungoma is a blessing to us, and I just want to reiterate what Oscar said, that kindly let us escalate this to the remaining 7 sub-counties. Bungoma has 10 sub-counties, and currently we are in 3 sub-counties. If you can be able to support us in that, we truly appreciate it. Congratulations.
Thank you so much. Before I bring on board our chief guest to climax the occasion, I want to say that Lambisia Wasike Aaron from the County Health Management Team. I'm here to represent the CEC. English has been transiting for quite some time. Initially, we used to say that I am busy, that's why I didn't turn up. It has transited to due to committing tasks, I'm not able to turn up. But now we are in a better dispensation where with due to exigencies, we no longer saying that due to committing tasks, we are saying that due to exigencies, I was not able to come. So due to exigencies, because health department deals with emergencies, and therefore due to exigencies is not here. However, I'm here to let us know, as the representative director has said and my colleague, that I coordinate
rehabilitative services and submitting mainstreaming in the county. And I want to tell us that it is not an easy thing, as quite a number of us have alluded to it. I want to say that there is a very high stigma when it comes to addressing issues of mental ill health. And 2024, OCHA was with us when we wanted to celebrate the Mental Health Day, 2024 October to be in particular. You remember, as Department of Health, because of limited resources of what we do, we wanted to get some funds from some partners from this county, Bungoma. And myself went to one of the bank, I won't mention it for security reasons. I went to one of the bank in this town, and the manager told me that you want me to support Mental Health Day? How is it going to benefit me? How is it going to benefit me? Because if you are having a different day, celebrating a different day of a different activity, I will come with my people and they will register people so they can become members in my bank. But mental health, how? How? So that's how it can be that actually when we have a partner coming on board, the way that the basic need, basic right has come on board, it is very handy. Because the Department of Health is ready, willing to partner with the willing partners and existing partners. Now, as we stand here, we want to tell us that you are an existing partner in Bungoma County. And we are delighted that we have an existing partner in the name of its basic right. And therefore, we celebrate you. And we welcome you to continue being with us. I know we had a conversation yesterday with the Wasiri, with the director, with quite a number of you as we were walking around yesterday. And the big question was, the entry has not been a big deal. The big deal has been the exit. When you exit, what is the sustainability? So we are actually concerned about the sustainability, because entry, anybody can enter. As we speak, we have around 25 partners currently supporting the Department of Health. But we always ask, what is the exit? As you exit, what is the sustainability? And therefore, please, I have heard him say, I have heard every other person say, let's address the issue of sustainability so that we don't know that we have reintegrated in the community back to the road. Did you know that the mental person is the only one, just like a prison person is never discharged from the hostel but paroled? My senior from the department of the national department is there. We don't discharge mental patients from the wards. We parole them. But all the others, we discharge them. Why? Why do we discharge and this one we parole? Because coming back are high. So, thank you so much. Feel much welcome. Any other time, we look forward for partnering with you. The CEC is ready to ensure that he fast tracks the policies. The mental health policy, that is his role and he is on top of it. I know he has pushed quite a number to the county assembly that this issue is no longer under the carpet, is no longer in the bedroom, but it's in the sitting room and even is on the road for all and sundry to see. So thank you so much. And without much ado, I want now to welcome the Deputy Commissioner to crown it all. Thank you so much.
Thank you very much. The of Health. Good afternoon. The current director, the former director, and the future director. I can see how need are organized. I like speaking too much because I've been a field officer. So I like, and particularly the concerns that have been talked by other. But because of time, and you'll be going to Zikaki, I may say much. I just want to say that much for the person, people to themselves and forwarded the vision, and those who are taking to the vision to the future. The founder, those who picked the vision at the initial stage, and those who will take it to the future. I thank you very much. I also thank all other stakeholders for being part of this journey, forming synergies, collaborating with each other to have a success of this basic need. No, when you, in fact, I'm very happy for this organization, Basic Needs, because through what Kengoli said, they are the first people to take mental health to another level. Where mental health was, mental illness was stigmatized for a long time. Where we have seen mental patients being tied with nyororo's, being put in a room, tied. Now they are stigmatized. So I'm happy to see the stigma going down. People accepting that this is